Welcome back to our channel, where today we'll be delving into the future and exploring the looming health crisis of 2050. This scenario may seem distant, but if we fail to take proactive measures now, we could face catastrophic consequences. Even as early as 2024, we are already witnessing warning signs of this crisis. Global health is under unprecedented pressure due to climate change, pollution, urbanization, and socioeconomic disparities. These factors are straining healthcare systems and worsening existing health issues, setting the stage for a potential crisis by 2050. Let's break down these elements and understand how they could lead to a major catastrophe. First, let's talk about climate change. The alarming rate at which our planet is warming has profound implications for public health. Rising temperatures result in more frequent and severe heat waves, leading to heat-related illnesses and deaths. Vulnerable populations, such as the elderly and those with pre-existing health conditions, are particularly at risk if global temperatures continue to rise unchecked. By 2050, the number of heatwave-related deaths could skyrocket. Climate change also impacts the spread of infectious diseases. Warmer temperatures expand the habitat range of disease vectors like mosquitoes and ticks. This means diseases such as malaria, dengue fever, and Lyme disease could become more widespread, affecting regions that were once disease-free. Moreover, the increasing frequency of extreme weather events like hurricanes and floods can contaminate drinking water supplies, causing outbreaks of waterborne diseases. The melting of glaciers and polar ice caps, another consequence of climate change, carries significant health implications. These frozen masses store vast amounts of fresh water, and their melting disrupts water supplies for millions of people. Furthermore, the release of ancient pathogens from melting ice could reintroduce new or previously eradicated diseases into human populations. Air pollution is another critical factor contributing to the health crisis. As industrial activities and urbanization continue to surge, so does the emission of harmful pollutants into the air. Particulate matter, nitrogen dioxide, and sulfur dioxide, among others, can cause respiratory and cardiovascular diseases. If current trends persist, by 2050, air pollution could be responsible for millions of premature deaths worldwide, according to the World Health Organization. Indoor air pollution also poses a major concern, especially in developing countries where biomass fuels are commonly used for cooking and heating. Inhaling the smoke from these fuels can lead to chronic respiratory conditions such as COPD and lung cancer. As populations grow and urbanize, the demand for energy will rise, potentially worsening indoor air pollution issues. It's crucial that we recognize these warning signs and take proactive measures to address the looming health crisis of 2050. The time to act is now, to ensure a healthier and safer future for all. Stay tuned to our channel for more insights and solutions regarding this pressing issue. Water pollution is a serious problem that we can't afford to ignore. The discharge from industries, runoff from agriculture, and improper waste disposal all contribute to contaminating our water sources. This contamination poses a risk to our health, including gastrointestinal illnesses, reproductive issues, and neurological disorders. It's already a challenge for many people around the world to access clean drinking water, and by 2050, billions of people could face water scarcity, creating even more problems for public health. Now let's shift our focus to urbanization. By 2050, nearly 70% of the global population will reside in urban areas. While urbanization brings economic opportunities and improved services, it also presents significant health challenges. Overcrowding in cities strains infrastructure, including healthcare systems, resulting in inadequate access to medical care. Slums and informal settlements often lack basic sanitation and clean water, increasing the risk of disease outbreaks. The urban lifestyle itself contributes to health problems. Sedentary behavior, unhealthy diets, and exposure to pollution are common in urban environments, leading to non-communicable diseases like obesity, diabetes, and cardiovascular issues. Mental health problems, such as stress, anxiety, and depression, are also more prevalent in urban areas due to factors like noise pollution, social isolation, and high living costs. These health challenges are worsened by socioeconomic disparities. Low-income populations often have limited access to healthcare, nutritious food, and clean water. This disparity leads to significant health inequities, with disadvantaged groups experiencing higher rates of illness and lower life expectancy. If we don't address these disparities by 2050, the gap between the health outcomes of the wealthy and the poor could widen, creating a more divided society. Globalization and our interconnected world also play a role in this health crisis. Diseases can now spread more rapidly across borders due to the ease of travel and trade. The COVID-19 pandemic has shown us how quickly a virus can travel, causing widespread illness and disrupting economies. By 2050, if we don't strengthen global health systems and improve our ability to respond to emerging infectious diseases, the threat of pandemics may increase. It's crucial that we take action now to address these pressing health issues. By working together, we can protect our water sources, improve urban health, reduce inequalities, and strengthen global health systems. Let's create a healthier future for all. The rise of antimicrobial resistance, AMR, is a significant concern. The overuse and misuse of antibiotics have led to the emergence of drug-resistant bacteria. By 2050, it's projected that AMR could cause 10 million deaths annually if new antibiotics are not developed and current practices are not improved. This would represent a major setback for modern medicine, making previously treatable infections deadly once again. The food system is also under strain, contributing to the health crisis. Climate change, soil degradation, and water scarcity are affecting agricultural productivity. This can lead to food insecurity and malnutrition, particularly in vulnerable populations. By 2050, it's estimated that the global population will reach 9.7 billion, putting additional pressure on food production systems. Ensuring food security and promoting sustainable agricultural practices will be critical to mitigating the health impacts of these challenges. Now that we've outlined the causes of the health crisis, let's discuss the potential impacts on healthcare systems. Healthcare systems around the world are already facing significant challenges, including resource constraints, workforce shortages, and inadequate infrastructure. By 2050, these challenges could be exacerbated by the increasing burden of disease and the growing demand for healthcare services. The financial strain on healthcare systems could be immense. As the prevalence of chronic diseases, infectious diseases, and environmental health issues increases, so will the need for medical treatment and intervention. This could lead to rising healthcare costs, putting pressure on both public and private healthcare providers. Governments may struggle to allocate sufficient funds to healthcare, particularly in low and middle-income countries. Workforce shortages are another critical issue. The demand for healthcare professionals is projected to increase, but the supply may not keep pace. This could lead to overworked and understaffed healthcare facilities, reducing the quality of care and increasing the risk of medical errors. Training and retaining healthcare workers will be essential to address this challenge. The technological landscape of healthcare will also evolve. Advances in medical technology, such as telemedicine, artificial intelligence, and personalized medicine, have the potential to transform healthcare delivery. However, the adoption of these technologies will require significant investment and infrastructure development. Ensuring equitable access to advanced medical technologies will be crucial to preventing disparities in healthcare outcomes. Public health infrastructure will need to be strengthened to address the health crisis. This includes improving disease surveillance systems, enhancing emergency preparedness and response capabilities, and investing in health promotion and disease prevention programs. The health crisis of 2050 requires urgent action. Community engagement and education will be crucial in promoting healthy behaviors and empowering individuals to take an active role in their health. Public awareness campaigns can encourage vaccination, proper hygiene, and healthy eating, leading to better health outcomes and reducing the burden on healthcare systems. Addressing climate change is paramount. We must reduce greenhouse gas emissions, transition to renewable energy sources, and implement sustainable practices to mitigate its health impacts. Global cooperation and strong political will are needed to combat climate change effectively. Improving air and water quality is critical. Enforcing strict regulations on industrial emissions and waste disposal, investing in clean energy and sustainable agriculture, and ensuring access to clean drinking water are essential steps to promote overall health. Urban planning and infrastructure development play a significant role in improving public health. Designing cities with green spaces, efficient public transportation, and accessible healthcare facilities can promote healthier lifestyles and reduce pollution. Strengthening healthcare systems, addressing socioeconomic disparities, and promoting healthy behaviors and lifestyles are important strategies to address the health crisis. We need global cooperation, improved disease surveillance, and collaborative efforts to protect global health. Now is the time to take action and work together to build a healthier future for all.